I'd like to introduce myself. My name is Mark Ibanez, the sports director at KTVU Channel 2. How are you? Anybody watch Channel 2 out there? It's always nice to greet an audience that doesn't have a remote control in their hands. I appreciate that. I think you might gather from the fact that I've been in sports broadcasting for 33 years that I have a very strong passion and love of all sports. And with that in mind, when they asked me to do this, I was thinking about how important it is to not only have that love for the game, but if you have passion for not just football, which when we talk about concussions and growing medical concern, that seems to be the first thing that comes to people's minds. But it's soccer, it's lacrosse, it's really every sport. And I think if you have that passion and love for the game, then you have to have the passion for increased safety features and a way to help protect our young athletes, not just the professionals. And I think that's part of the reason that we're here. And I think in years to come, we'll find that the movement to make this happen and have the public consciousness and awareness at a greater level will come about through the media and through gatherings like this. And we've got some very special guests for you. We've got some former pro football players. We've got some leaders in the medical field that will talk about it. We'll try and make this hopefully as interactive as possible too. We'll take your questions, and you'll also hear from people who are in the midst of this, and it is very much a part of their life. And I'm particularly interested in hearing how former NFL players are dealing with this ever-growing situation in their sport. And we've got 4 former players, which I'll introduce to you in just a few minutes. But first of all, I'd like to say that events like this, happenings like this, could not take place without our sponsors. And I'd like to just take a moment and thank some of the people who made this event and this afternoon possible. First of all, our lead sponsor, the Lucille Packard Children's Health Alliance. And of course, our host here. Appreciate the applause for them. We've got quite a few sponsors that I want to give credit to, so maybe we hold the applause, except maybe for the Marriott, because they're our hosts. Let's hear it for the Marriott. Tri-Valley Pediatrics, Kaiser Permanente, I like the spirit, Palo Alto Medical Foundation, Tri-Valley Orthopedic Specialists Incorporated, the local television station KKIQ, Livermore Pleasanton San Ramon Pediatric Group, and Valley Care Health Systems, DPI, and the San Ramon Regional Medical Center as well. All very much a part of making this happen, and our thanks to them. Now we can applaud all of them. With any ball game, with any sporting contest, there's always a first pitch, there's a kickoff, there's something that gets the ball rolling. And the momentum that we have seen start to take place in the last few years with regard to safety, particularly with regard to concussions and the like, had its start from a young man, and I'm going to let you look at about a 5-minute video, who really deserves a lot of credit for getting the ball rolling. And let's take a look at his story, and then we'll further address it.
When he was 13, Zachary Lysted, Maple Valley, Washington, near Seattle, loved to play football as much as his dad, Victor, loved watching him play.
Oh man, dude, he was awesome. Zach never shied away from going after the ball carrier when he was on defense.
In October of 2006, Zach hit his head hard while making this tackle. There was an injury timeout, but just minutes later, Zach returned to the game.
Had he stopped after his first hit and walked away, we'd have a different story to tell today.
After the game, Zach and his father were walking off the field together when Zach collapsed, and the Lysted family's nightmare began.
He's like, "Oh, Dad, my head hurts. It hurts real bad." I'm like, "What's up?" And then it progressively got worse. When he collapsed, he didn't, "Daddy, don't let me down. Don't lay me down. Dad, my head's killing me." That's the last thing I remember him saying, for 9 months.
A comatose Zach was airlifted to Seattle's Harborview Medical Center.
He was minutes, maybe an hour away from dying. He had a bleed on the right and the left side of the brain that was compressing his brain, and that required them not only to take off the bone each side of his brain and leave it out, but actually take out the blood clot.
When you looked into his eyes, he wasn't there.
Zach would be at Harborview for 93 days. It took him 9 months to speak. All that time, deep within him, Zach's cognitive functions remained intact.
I remember crying just to try and get my voice out.
What's that like when you can't communicate what you're feeling?
It sucks. It's the worst feeling in the world. I would never wish it on anyone.
Get tall, get tall. Get tall. Let's go, Zach. Get tall, get tall.
This is 19-year-old Zach Lysted today.
Let's go push yourself, Zach. You gotta go faster now.
5 years after his traumatic brain injury, a near miracle forged from countless hours of rehabilitation.
Come on, Zach. You got it.
And Zach's phenomenal courage and will.
It took him 3 years to even be able to stand up on his own and get out of a chair.
What's it feel like to be getting better at walking?
Well, it feels good. It's like the most difficult thing I've had to do ever in my life. It's worse than like topping the girls.
Zach and his parents vowed to spare other families from their ordeal. So with their lawyer, they drafted a bill mandating protection for young athletes suspected of having a concussion, the Zachary Lysted Law.
If a kid is, quote, suspected of having a concussion, unquote, they must be removed from play. The child can go back in to the practice or the competition, but only if they've been cleared by a licensed healthcare professional who's been trained in the evaluation and management of concussions.
The bill passed both legislative houses in Washington state unanimously and was signed into law May 14, 2009. By 2010, Zach's story had drawn NFL Commissioner Roger Goodell's attention.
We talked about getting this passed in a few states. He says, no, we're going to get it passed in all 50 states.
As the NFL took the lead in advocating for the Lysted Law, the commissioner sent Zach this ball. The Lysteds sent him Zach's football card.
He told my son, Zachary, your card is the first thing I see on my desk when I come to work, and your card is the last thing I look at before I leave to go home.
He even sent a message to Zach on the morning of June 10, 2011, when Zach would try to walk across the stage to receive his high school diploma.
Zachary Gordon Lysted!
Oh man, dude, the place erupted and it was awesome.
That was too much, man. It made me feel so happy. I felt so blessed in that moment.
By changing the culture and getting laws passed in over 30 states now, kids are being saved. I think it's countless number of people over many decades that we're going to see this has a very positive effect.
Everyone has their challenges in life, and this is my challenge. It's my calling.
Zach Lysted, quite a hero. The NFL and the commissioner haven't quite reached their goal yet. 50 states have not ratified such legislation, but happy to update even that video. 45 of our 50 states have now put together and enacted legislation that mirrors the Lystedt law. California's AB 25 went into effect January 1st of 2012, and they have followed suit, and hopefully we can get those 5 last states to get in the ball game, so to speak. Our first speaker today is a local product. She was an athlete, and a stellar athlete, as a matter of fact, at Foothill High in Pleasanton. Her name is Dr. Christy Boyd, a sports medicine specialist with an extensive background in both athletics and medicine. I'd like to introduce her at this time to start our program. Speaking of it, thanks.
Thank you guys very much for having me, and also thank you guys for taking time out of a very, very busy time of year, very busy day of the week to be here to educate yourself about concussions, because this is important, and just the fact that you're here is a huge first step. Watching the video about Zach and Zach's law, it's quite sobering. I'm going to spend the next 20 minutes or so talking to you basically about what is a concussion. That is the most dramatic case, or close to the most dramatic case of what we're going to see. Although, and it's very rare, and we'll talk about that as well. Much more common, though, is what we're seeing every day on our sports fields. All right, so sports injuries. Anybody have one of those? To the ankle down below? Ever had that before? Anybody? One person? Anybody ever do that? Pull a hamstring, pull a quad, flip off the field? Yeah. How about that? Come off the field with a leg looking like that? Then concussion is no different. It's a sports injury. No different than any other sports injury we have, and we need to assume it's part of the game, it's a risk of the game, and we need to learn how to treat it appropriately. So hot off the press, right now there's a lot of stuff going on in the media about concussions, and professional athletes get most of the attention. However, the injury is much, much more common in high school sports just by base of the sheer volume of kids who play high school sports. What we see on TV is just the tip of the iceberg of the problem. Concussion research and the treatment have evolved rapidly, but our care of concussion is definitely lagged behind. All right, so why is this such a big deal now? Why is it all of a sudden that we're hearing about it more in sports? I mean, I grew up playing sports, and it wasn't something we ever really talked about. Some of it's because there is an increased incidence. We have bigger, faster kids now than when I was little. We have more opportunities. Kids spend more hours per day, per week, per year in organized sports activity, where the risk of this type of injury is greater. There's also obviously increased awareness of concussion injuries, high-profile professional athletes, high-profile catastrophic outcomes, and that's actually what's really trying to kind of tipped us over into caring about this more. Second impact syndrome, which is the video we just saw, is one of those. And more than 20 states are responding to that data. We'll talk about that. We got Zach's law, Max's law. There's laws all across the country. Ours is really quite simple AB bill, but a lot of the states are named after unfortunate outcomes from second impact syndrome. There's also increasing evidence that there is long-term consequences from these injuries, and we're seeing that daily, and we need to pay more attention to it. All right, so today's goals, to understand what is a concussion, how does it happen, what are the symptoms, what are the risks of having a concussion, what are the risks of going back too soon once you no longer have symptoms, sorry. What are the risks of having a repetitive injury, and can concussions be prevented? Is there anything you can do to prevent this injury from happening at all? And what about AB 25? That's what we're going to talk about. All right, I got 20 minutes. I'm going to fly. I have 22 minutes, actually, not just 20. So a few facts. A concussion is an injury to the brain. All right? It is serious. These dings, these getting your bell rung, these are things we have to take seriously. Again, most people in this room are going to believe that because you're here. What is concussion? The official definition that we can use in a setting like this is a temporary, trauma-induced brain dysfunction. Sometimes it's called a mild traumatic brain injury. The mild does not refer to it being a mild injury. It refers to the amount of force used to cause the injury. All dings, all bell rings are concussions. And it's just, the terminology has to be very clear when we talk about these injuries. These are all concussions. So we're going to test your knowledge here. We're going to have a little bit of fun, try to keep this a little bit interactive. So, myth or fact? Concussion occurs when there's direct hit to the head and the athlete gets knocked out. Right, there's a good answer. So that's a myth. Most concussions do not involve loss of consciousness. There does not have to be a direct hit to the head to cause a concussion. Most injuries actually happen during the run of play when the body is jarred, either by a body-to-body contact or a head contact, causing a sudden shaking of the head. All right, so what's going on? The brain is soft, the skull is hard. The brain gets shaken around inside the skull, which causes damage to the cells. So injured brain tissue, the brain needs fuel to function, that's glucose. Injured brain tissue turns off the blood supply and doesn't provide glucose to the cells. So now you have these injured cells that don't have any fuel, and they are not happy, and that leads to a bad mismatch. Causes physical, emotional, and cognitive, brain function symptoms. Recovery requires that dreaded four-letter word. In my clinic, that is a four-letter word. Nobody likes to hear it, but it does require rest to heal. All right, most high school athletes recognize and self-report a concussion injury. Myth or fact? All right, okay. That is a myth. The fact is that a recent study of high school athletes showed that 40% of athletes continue to play their sport despite having symptoms of concussion. Why? Well, there's probably a couple reasons. Most do not think the injury is serious. If you ask them why, they don't think it's a serious injury. Under-recognition is also a big issue. If you ask a lot of high school athletes if a ding is a concussion or getting your bell rung means you've had a concussion, they'll say no. And that's an education component that we have to definitely work hard on. All right, signs of a concussion. Signs are what a coach, a teammate, a trainer, or a parent might see. This is not what an athlete feels. This is what you as an observer are going to be looking for. An athlete who's dazed, who's confused, who's forgetful, who looks a little bit clumsy on the sideline, who answers questions slowly, seems to work really hard to come up with the right answer. Mood or behavior changes, seems excessively happy or sad, unable to remember things before or after the game. Those are all signs that a concussion has occurred. It's also okay to say that, I don't know what it was, they just didn't seem quite right. That is also an important sign that somebody might have something going on. So what an athlete feels, this is what an athlete's going to self-report. They have headache, they have head pressure, dizziness, trouble with balance, some vision changes, things are blurry, they're seeing stars, feeling sick to their stomach, throwing up, sensitive to light or noise, feeling sluggish, groggy, or in a fog, like they're just walking through molasses, trouble falling asleep or sleeping too much. That's a little bit hard to tell with teenagers. Concentration or memory problems, some confusion, and just not feeling right. Just haven't felt quite right since it happened. Again, those are all symptoms of a concussion. All right, myth or fact, symptoms of a concussion begin right after the injury occurs. Got a quiet crowd here. False, okay, you're all correct. I'm going to trick you here. There's going to be a fact, I promise you. It is more common for symptoms to be delayed in young athletes. So no, symptoms of concussion do not always occur right after the injury happens. It can be a solid 6, 8, 12 hours later until somebody develops any symptoms. And again, it's more common in high school and college-age athletes for those symptoms to be delayed. All right, myth or fact, a concussion that does not involve immediate symptoms is less severe than one when the player has to be helped off the field.
Myth.
All right, thank you. Appreciate it. That was that to me. Again, watch out. Don't just assume it's going to be it. The severity of concussion is determined by the number of symptoms you have, how long they take to resolve. So there's no way at the time of injury you can determine how significant the concussion is. You can say, yeah, we have symptoms of a concussion, we're going to give you the diagnosis, but usually it takes time to figure out how significant the injury is. Grading concussions is old school. We don't do it anymore. And again, this makes me feel old to say this because when I was actually trained in my fellowship, we were trained to grade concussions. Now we're not doing that anymore. Medicine evolves. I mean, if you looked at how we took care of an ACL tear in a 40-year-old woman 30 years ago, we wouldn't fix it. If you looked at how we took care of a meniscal tear in a football player 30 years ago, we'd take it out, right? Don't need it. And so management of concussions is evolving just like every other injury we have in sports. We don't grade them anymore. All right, myth or fact, an athlete who is taken to the ER has had a normal head CT scan and neck x-rays and is discharged home is considered medically cleared to return to play. That's a myth. That is A normal CT scan, an MRI, or an X-ray does not rule out a concussion. A concussion is a functional injury, not a structural injury. No test can visualize a concussion. I always tell my patients in my clinic, it's an injury to the software of your computer, not the hardware. So again, hard to detect. It is a clinical diagnosis based on your signs and your symptoms, and further medical evaluation is needed several days after the injury to determine if the athlete's cleared to go back to play. No same-day return. And somebody else is going to talk more about this, so I won't go into it. Once you've had symptoms of concussion, even if you feel fine in the afternoon, you cannot go back to play. And you cannot prescribe X number of days before you can go back to play. So say you got injured on a Saturday, you saw your doctor on Monday, they're not going to be able to tell you, okay, in 7 days, no matter what, you can go back and play. That doesn't work that way. There's a graded return to play, and again, I'm going to let somebody else talk about that one today. So AB 25, that's California's legislature regarding concussion. It's actually it's almost identical to Zach's law. The three core components is any young athlete suspected of suffering a concussion or have in a after-school sports event. That's the only thing that needs to be clarified. Unfortunately, it doesn't include PE, even though we're going to assume that it's going to be treated the same way. But it's a school-sponsored after-school event. Cannot return to play the same day. And suffering a concussion means any concern, sign, or symptom of a concussion. Once removed from play, an athlete cannot return to play until they've been evaluated and cleared by a licensed medical professional trained in the management and care of concussion. And the last thing is, parents must complete education form prior to their child participating in an organized school-based sports activity. So now parents are being encouraged to understand, recognize concussions. One of the major things missing in this is what we're doing right here, and that's educating coaches, educating athletes, educating parents in a more formal setting, and there are some things coming up in the works in our state to address that. All right, myth or fact, returning to play while still experiencing symptoms of concussion can cause sudden death. Now, there's your fact. Second impact syndrome. This is a bunch of pictures. Zach's in the bottom right corner. Just happened to be, I had the slide put together before you guys showed the video, which worked perfectly. These are all guys who've had unfortunate outcomes from this sort of injury. So what is second impact syndrome? It's a very, very rare injury, but it's one obviously you don't want to happen to you or your child. A second concussion occurs before the brain fully recovers. We don't completely understand why it happens, but there's usually one injury. The player or athlete either doesn't recognize the symptoms or doesn't tell anybody about it. They have a second injury, and for whatever reason, it causes sudden swelling in the brain. It's fatal in up to half of athletes who have it. And it's unique to the developing brain. Most cases are in high school age boys. And football, obviously, because of the just volume of contact is where we usually see it. All right, myth or fact, continuing to play with a concussion can cause your team to lose, affect your college sports recruitment, and even affect your ability to get into college. That is true, because everybody's focused on college, so let's especially this time of year. Concussion affects your reaction time, decision-making, and vision, which affects performance. A short-term consequence of having a concussion is you're not as good of a player. So even if you think you're fine, and you don't want to tell anybody, and you go back out there and you play, you're going to, it affects your ability to play. My husband's a college soccer coach, and one of his games, one of his players, who was a starter, was playing absolutely terribly. And I'm thinking, what in the world? Why is he still on the field? This guy's, usually a really good player. He was playing really, really poorly. Finally, he was taken off, and I asked him after the game what was up with him. He's like, oh, he took a header in the beginning of the game, didn't tell anybody, and he just wasn't feeling right. He couldn't remember anything, but he didn't want to leave the field. And you could clearly tell in his performance, and it was the coaches who recognized it and pulled him off. So that's going to affect, if you go to an event where you're being recruited, you're not going to look so hot. It increases the risk of second injury and post-concussion syndrome. Again, somebody else will talk briefly about that, which can last months and significantly affects your school participation, your grades, your SAT scores. Again, not good if you're trying to get into college. And lastly, recurrent concussions can mandate a premature return from sports. So if you are looking to play college sports, college soccer, and you've had 6 or 7 or 8 concussions, it may be that somebody recommends that you retire, and the team may not want somebody who's going to need to retire. Again, the focus of concussion care is not on getting you into college, but from a young athlete's perspective, sometimes it's helpful to think of it in these terms. All right, post-concussive syndrome, persistent symptoms of concussion. They can be debilitating. They can be really difficult to treat and last months. Usually it's weeks to months. Symptoms of concussion, most common if you have a second injury while still recovering from your first. And this is why it's so important that we identify the concussions when they happen and treat them appropriately from the very beginning. Girls are more likely to be diagnosed with a concussion than boys. True or false? That's a tough one. It's more likely to be diagnosed is the part that's the kicker here, and it is true. And it's a fact. The girls are more likely to be diagnosed with a concussion. In the same sport, girls are diagnosed more with concussion. Soccer was the one comparison. Soccer is the #1 rate of concussion in girls' sports. Why? We don't really know. Is there a gender difference in the injury? There's some evidence that there may be. Girls may be more likely to report in girls' sports. There's not as big of a stigma of being machismo. And there's a question, is there a neck strength difference? Is there a technique difference? Do girls head the ball differently than boys in soccer? Again, all of this is yet to be determined. All right, once an athlete's symptoms are completely resolved, the brain has made a complete recovery and they are no longer at risk of another concussion. It's a tough one. Anybody know who the soccer player is? This is Taylor Twellman. We actually still need him, but he can't play anymore because he's had recurrent concussions. He's a great striker on the U.S. national team, but he's no longer playing. He commentates now. The answer is, the question is myth. We don't know. The risk of concussion increases with each injury, despite allowing for full return to sport. The evidence is a little bit mixed about whether or not, once you've made a complete recovery, whether or not you're still at risk for another injury. But what we do know is some studies show that high school athletes that have had a concussion are more likely to suffer another concussion that same season of sport. And that athletes with multiple concussions are more likely to develop persistent post-symptoms than athletes who have not had a concussion before, including developing symptoms of depression. All right. So concussion prevention. This was a hard slide to even put together. Most concussions are not preventable. It's a part of sport. It's the risk you take when you play sports. Recognition and proper treatment can minimize the severity of a concussion and can minimize the long-term consequences. There's some benefit in proper fitting of sports equipment. The number of football helmets that are not fit properly at the high school level is quite shocking, and making sure that you have the right size helmet and it's fit properly. But helmets themselves do not prevent concussion. Proper technique, heading the ball. There's some thought about girls tend to go up and head the ball without putting their arms out to provide a little bit of space around another athlete, and a majority of heading concussions occur from head-to-head contact, not head-to-ball contact. Also, proper technique in tackling, not leading with the head. Neck strengthening, again, there's some evidence that there may be helpful. It may be helpful to a limited degree. Rule changes in hockey, that's been a big one, limiting the checking the until the older levels. There's been minimal benefit, if any, shown from wearing soccer headgear and mouth guards. Again, the jury's a little bit still out on that, but the evidence that has been shown so far is not super strong. All right, head trauma, especially concussion, continues to be the most underdiagnosed problem in sports. Medical treatment for concussion focuses on allowing the brain to heal itself and to utilize rest. And most concussions do heal with proper treatment. I think that's it for me. The end. Education, that's what you hear today. It's a path from cocky ignorance to miserable uncertainty, and that's where we are with concussions.
Thank you, Dr. Christy Boyd. As I said in the beginning, I just wanted to make sure that it was interactive, and I know we've been a little bit of a quiet crowd, but feel free now, while we've got her up here, if you've got any particular questions about her presentation. We're going to have other doctors up here that may cover it, but if you've got anything for a doctor right now, we'd be more than happy to, yeah. Go ahead.
When you talk about the brain shutting off the circulation in the traumatized area, and so the cells aren't getting oxygen, how does, apparently the brain is a slow healing organ, how does it reestablish itself, and are there things that an athlete who's had a concussion can do, either through not only medication, but maybe diet, nutrition, how does the brain heal, and then how can you help it heal better?
I'll give you kind of a brief answer, and then I'm going to let one of our other speakers kind of get a little bit more into that. it's a blood flow issue, that the blood flow gets decreased, and so that there's not glucose, which is the fuel. It's not necessarily an oxygen deficit, it's more of a fuel deficit. And what tends to help the brain is rest. And so what people don't realize is that everyday activity is not resting your brain. And so sometimes it takes some really aggressive resting of the brain, of cognitive activity, thinking, studying, going to school, playing on your computer, playing video games, talking to friends. It takes all of that to allow the brain to rest. It's kind of like trying to go run a mile in PE on your sprained ankle. You just can't do that. And so really that's the first step in getting the brain to heal faster and allowing it to reestablish blood flow.
Thank you, Dr. Christy Boyd. All right. Next up, I'd like to introduce Dr. Ronald Wyatt. He's an orthopedic surgeon and the head of Kaiser Sports Concussion Management Program, and he's going to address sideline concussion management. I think for those of you pro football fans, remember this past year we had a very controversial event happen with Colt McCoy, quarterback of the Cleveland Browns. There seemed to be a mix-up of the diagnosis on the sideline, and he was allowed to return to a game, and it caused quite a lot of consternation. And so at this time, please welcome Dr. Ronald Wyatt.
Good afternoon. It's a pleasure to be able to speak to you today about this very important topic of concussions. Just to let you know a little bit about me, I'm an orthopedic surgeon with Kaiser Permanente. I've been with them for the last 20 years, first in Martinez and now in Walnut Creek. I have a very active sports medicine practice, and I have been a team physician for some high school and some college teams. And as is standard in our industry, I have no conflicts of interest to disclose. But I do have one disclaimer. I think I've been introduced as the head of the Kaiser Permanente Concussion Management Program. Actually, I am the co-chair of the Kaiser Permanente Diablo Service Area Concussion Task Force. That's a big mouthful, isn't it? Actually, the task force is made up of some very interested physicians, very dedicated physicians, and they represent many different specialties. And our goal is to make Kaiser Permanente one of the leaders in concussion management and prevention. Now, I'm also a member of the Northern California Sports Medicine Peer Group, which has been one of the instigators of our, in establishing a standardized concussion care paths for our members. It's been instrumental in getting us to standardize our care of concussions, and even though it is a multi-specialty group also, I think you may guess where my loyalties are. So we're going to talk today a little bit about concussion management, on-field concussion management. I've been asked to talk for that for the next 20 minutes. And I realize that our audience here is made up of coaches, of trainers, parents, and student athletes, all of you who are interested in concussions. Many of you may be already quite knowledgeable about concussions, maybe more so than some of the experts we have here today. And I realize that if you're here on a Saturday afternoon, wanting to learn about concussions is probably going to be a little bit about preaching to the choir. But I will therefore not try to give you a very comprehensive talk on sideline management and on-field management of concussions, because I think that may be a little bit too much. But I will focus on a few specific topics. In other words, what I'm going to call on-field management pearls. Now, I'm going to call these pearls no-brainers, okay? We all know what a no-brainer is, right? It's something that's very obvious and you don't need a lot of brain power to figure out. And so I'm going to call these pearls no-brainers because they are relatively simple and straightforward, and also because if an athlete doesn't follow them and gets multiple concussions, they're not going to have a brain left, right? So anyway, we'll call them no-brainers. There we go. So proper equipment, education, executions. So in terms of equipment, we've heard about the helmets and the importance of well-maintained safety equipment. There have been studies that have shown that properly fitting football helmets can significantly reduce the incidence of concussions. In terms of education, the Center for Disease Control's Heads Up program is an excellent resource for concussion information for coaches, parents, and athletes. And I highly recommend that every athletic program, before the start of the season, have a up-to-date concussion protocol and procedures manual, that they know the concussion on-field action plan, and that they talk with their athletes about concussions, again, before the start of the season. Having a sideline discussion with a concussed athlete, trying to explain to them why they need to come out of the game in the heat of the game and heat of the battle is not ideal, to say the least. Those discussions need to take place before the start of the season, before an athlete has a concussion. Finally, there needs to be execution, right? We all know about the importance of execution in sports, both on the practice field and during the game. We've heard that strengthening of the neck muscles has been shown to reduce the incidence of concussion, so this should be included in any strength and conditioning program. And we've heard the importance of having our young athletes, and particularly in football, use proper technique in tackling, not leading with the head or spearing. This can reduce the incidence of concussion. So all these principles, proper safety equipment, educating stakeholders, and on-field execution are important for the reduction of concussions. No-brainer number 2. Concussions occur in sports other than football. That should be obvious. Many of you probably here are not all football players. Of course, football is by far and away the most common sport for concussions, but concussions can really occur in any sport, including girls soccer, girls basketball, wrestling, boys soccer. Those are some of the most common, and baseball is another common one. Concussions can also occur in non-competitive sports, such as cycling, motorcycle riding, snowboarding, and skiing. So coaches in all sports and parents should be aware of the possibility that one of their athletes may or will sustain a concussion, and they should know the proper on-field steps to take in managing the concussion. Concussion no-brainer, number 3. The high school athlete's brain is not the same as an adult brain. High school athlete's brain is not the same as the adult brain. Now, having been the parent of 2 high school athletes, I can honestly say that this fact is readily apparent every day and not necessarily on the athletic field. But with regards to athletes and concussions, studies have shown that high school athletes are much more susceptible to concussions and do not recover as quickly from concussions as college or professional athletes. Now, this is the opposite of many musculoskeletal conditions in younger athletes. They often heal quicker than the older athletes, but this is not true for concussions. They are at increased risk and they heal slower. So greater vigilance is necessary, and conservative return-to-play protocols are necessary for our high school and our younger athletes. Now, we've already heard this one from Christy. It's a no-brainer, number 4. Loss of consciousness is not necessary to suffer a concussion. Loss of consciousness is not necessary to suffer a concussion. Athletes with concussions can exhibit a wide variety of signs and symptoms. There may be physical manifestations, emotional changes, postural abnormalities, or even cognitive ability. And while loss of consciousness does not signify that an athlete has sustained a significant traumatic brain injury, that does indicate that it has sustained a brain injury, one study showed that post-injury amnesia, not loss of consciousness, was the best predictor of concussion severity and prognosis for speed of recovery. Not loss of consciousness, but post-injury amnesia. Now, I became aware of this in my own situation when I was a third-year medical student. I was playing a pickup game of basketball, went up for a rebound, and another gentleman happened to get the rebound and swung an elbow. Caught me right on the side of the head, severe blow to my head, and I saw stars. I did not lose consciousness, but I definitely had amnesia. I didn't know my name. I didn't know where I lived, which was a problem because I was in a pickup game and they didn't know where I lived. I knew I had a wife, but I didn't know her name. And the only thing I remember was that I was a third-year medical student, and I kept thinking, if I can't remember anything, I'm going to have to repeat 2 years of medical school. And I was in a total panic, but luckily, even though I had severe headaches afterwards, the amnesia did clear, and I went on to graduate from medical school. But I am aware that post-injury amnesia may be more significant than loss of consciousness in terms of concussion. So if an athlete demonstrates any of these symptoms up there, then you have to suspect a concussion, okay? Concussion no-brainer, number 5. On-field tests should not be used by themselves to evaluate an athlete with a suspected concussion or to determine if an athlete should return to play. Okay? On-field tests by themselves should not be the complete or evaluation of a suspected concussed athlete. Now, there are many different on-field concussion tests and systems that are in use. These include the Maddox questions, the standardized assessment of concussion, the sport concussion assessment tool, the King-Devitt system, and the basic error scoring system. And each of these tests has their advantages and disadvantages, their benefits and limitations, and I'm not going to try to promote one over the other. They can be helpful in screening, as a screening tool for athletes with a suspected concussion. However, very important to remember that test results are only relevant if the signs and symptoms of our concussion are not present. In other words, if an athlete exhibits signs and symptoms of a concussion, he or she should be managed for a concussion irregardless of whatever on-field test shows, okay? So they can be used as an adjunct, but they're not the end-all to determine on-field concussion. That goes with the signs and symptoms of concussion. Concussion no-brainer, number 6. It's important to recognize the injuries that are associated with concussions and potential red flags that would indicate an emergency situation. In concussed athletes, the most common associated injury is a neck injury. And if there's any question or any suspicion of a neck injury, the athlete's neck should be immobilized and they should be sent for emergency evaluation by a qualified healthcare provider. Also, the conditions on the right there indicate emergency situations such as loss of consciousness greater than 5 minutes, confusion greater than 30 minutes, convulsions, focal neurological deficits such as loss of use of an arm or a leg or decreased feeling or a dilated pupil, persistent nausea and vomiting or persistent headaches, progressive neurological deterioration, or high-risk athletes such as those with hemophilia or on blood thinners. These are red flags and can suggest a more serious injury. And if your athlete has one of these red flag conditions, they require emergency evaluation. Don't wait, get emergency evaluation for these athletes. Just give me just 1 second. So, we're missing a slide here. So I'm just going to tell you, the slide number, the concussion no-brainer number 7. Never allow an athlete with a suspected concussion to return to play that day. We've heard that, right? Never allow an athlete with a suspected concussion to return to play that day. And the adage is, when in doubt, sit it out. Okay? When in doubt, sit it out. If there's any question, any concern at all, the athlete sits it out. And here's the, this is the 4-step action plan that's put out by the CDC in managing and how to manage a concussion on the sideline. And first, I should say that a coach or a trainer, as we've heard from Christy, should not try to judge the magnitude or seriousness of a concussion. That's a medical determination and should be done by qualified medical experts. And as we've heard, the seriousness of a concussion may not be manifest for several days after the concussion. So if you have a suspected concussion on the field, you should use this 4-step program action plan, okay? First, remove the athlete from play. No ifs, ands, or buts, okay? Number 2, ensure that the athlete is evaluated by a healthcare professional who is qualified to evaluate and treat concussions. You should notify the parents or the guardians about the possibility that their athlete has sustained a concussion and then give them a fact sheet on concussion. And you should keep the athlete out of play until they have been evaluated by a healthcare professional and the healthcare professional has determined that it is safe for them to return to play. So learn this 4-step action plan and employ it on the sidelines or on the field. So remember that highly motivated athletes do not want to be diagnosed with a concussion, all right? And they may deny that they have concussion symptoms. They will fight to stay in the game. Coaches, trainers, and parents need to be advocates for their athletes and emphasize long-term goals over short-term performance. We've heard about the risk of second impact syndrome and post-concussion syndrome. Don't put your athlete at risk for these serious conditions by allowing them to return to play with a suspected concussion. Concussion no-brainer number 8. Athletes who are returned to play should follow a graduated rehabilitation program. Some of you may be familiar with the old system of CAN2, and was it a major concussion or minor, and how many they have, and could they return to play? That's gone now, kind of. It's all, they follow a graduated stepwise program, okay? It begins with light aerobics, followed by moderate aerobics, then conditioning and strengthening exercises, then practice and drills, and finally back to normal gameplay. And if an athlete has a concussion, has concussion symptoms while they're going along this graduated stepwise program, if they have concussion symptoms at any step of the way, they return to the previous step. And there has to be 24 hours between each step. So there's 7 steps. It takes at least 1 week for an athlete to be able to get back and return to play after sustaining a concussion. And as Christy said, second impact syndrome does not require a second traumatic impact, but can occur simply from too rapid a return to full activities. So I hope that you found these concussion no-brainers to be helpful. Additional resources can be found at the Center for Disease Control's Heads Up Concussion Program and their website. Please use these guidelines and resources, and let's keep our athletes' heads in the game. Thank you very much.
Let's see if there's any questions for the doctor. Thank you. Dr. Ronald Wyatt, are there any questions for the doctor before he takes leave? Yes, sir.
What is the ortho group?
Ortho group? Can you repeat the question, please?
What is the ortho group?
The ortho group. Well, the ortho group is a group of orthopedic surgeons who are interested in preventing and treating concussions.
Okay. Thank you. Before we get to our panel discussion with the 4 former professional athletes that we've got on hand today, it's my great pleasure to introduce to you our keynote speaker for the day. His name is Dr. Mark Halstead, and he's the lead author of the American Academy of Pediatrics Guideline on Sports-Related Concussions in both children and adolescents. Let's give him a warm welcome here to the Pleasanton Marriott. Come on up, Doctor.
Well, thank you. I appreciate the invitation. I think I'm the headline keynote speaker just because I traveled the furthest away. I'm from St. Louis. I happen to be in this neck of the woods actually yesterday giving a talk up in San Francisco. So I'm really pleased to be able to be a part of this conference today. You know, I carry several hats. I'm a pediatrician by training, but I also work with guys like that you're going to hear from in a little bit. So I work with the St. Louis Rams. So I'm with the NFC West bottom dwelling team. So hopefully someday we'll actually start beating some of the Bay Area teams, but I don't know if that's going to happen anytime soon. I'm hoping changes in the works. So what we're going to talk to you today is some clinical practice recommendations of things that we usually suggest with dealing with concussions. So we'll talk about a little bit what do I do in the office. We'll talk about baseline testing. How do we treat the athlete, specifically related to things returning to school, returning to sports, and then when to consider retiring. You know, that's a big question. That's a loaded question when I get that in the office a lot, is how many is too many? So I'll put this up here just kind of for food for thought. So this is a 17-year-old high school football athlete, comes to you 11 days after his concussion. He has only mild dizziness, some light sensitivity. He has a headache that lasts only 30 to 60 minutes a day. He wants to play in his game in 2 days. His examination is entirely normal, so what would you do with this kid? So would we allow him to return with no restrictions? Would we allow him to return with a newer helmet? We allow him to play if his current symptoms don't worsen with exercise, or not allowing him to return to this game. And so just something to think about as we talk about some things here. And I think we've already talked about this. Well, actually, no, we haven't talked about this one here. But once an athlete's computerized neuropsychological test has returned to their normal baseline, they may return to play. And so you just think about this. I don't want the answer right now, and that would be either true or false. So, as been talked about already very eloquently, the concussion is an injury to the brain. And so there's many phrases that we use for that: ding, getting your bell rung, seeing stars, mild traumatic brain injury, and of course concussion. You know, it's a functional problem in the brain, and the way I describe it to my patients is just not working on all cylinders. I've used the computer analogy that Krista uses too. But it's just, again, it's not doing what it's supposed to, okay? And that's where the athletes are having their difficulties with. So we just look at rates in high school sports alone. Football obviously is the behemoth, and it gets all the attention, but people forget that soccer is not that far behind. And so, you know, we see this up here, and we'll see it. We got soccer, we got basketball here, and certainly some of the sports that I think unfortunately are forgotten a little bit with concussions as well. So even though that football gets all the attention, we certainly see plenty of concussions from other sports as well. So what do I talk about and what do I ask? How did it happen? So, and that's if the person remembers that. As was already discussed, sometimes amnesia is a problem after that person has a concussion. So they may not know exactly what happened, okay? And sometimes when they have that amnesia, they may not ever remember the events that happened or that immediate period of time afterwards. And sometimes athletes like to focus on that as like, gosh, why can't I remember what happened? And then sometimes they'll remember because other teammates or coaches, or they'll watch film and then they saw exactly what happened, they remember. But you know, when we talk about the whole thing of the software analogy that Christy gave earlier, I just tell patients it's kind of like their brain just didn't hit the save button, okay? So, you know, didn't make that memory, so they probably will never ever remember that event unless they've done something to see what happened, okay? So I don't try and have them try and really kind of focus on that if they can't remember, but if they do remember what happened, that's helpful. Did they have a loss of consciousness? And has already been described, that's a very infrequent problem that we see with concussions. In fact, 90% of concussions never have a loss of consciousness. I ask about have they have other concussions, and it's not just from sports. Do they get it from banging their head on a door frame, getting up and down the stairs? Is there something else that they may have had, so a concussion that they had when they were a kid? What symptoms they have, how are they doing in school? That's a huge important part with dealing with a kid with concussion is are they really struggling trying to keep up in class? Can they remember? Can they focus on things? Have their grades started to take a downward turn? Do they have migraines? There's actually been some evidence that athletes or parents of those athletes that have migraines seem to have a higher susceptibility to concussions or having increased symptoms after a concussion. And do they have already any other underlying troubles with learning, or do they have attention deficit disorder? Those athletes oftentimes have more severe symptoms or will take a longer time to get better. And then do they have any other mood problems to begin with? Are they depressed already before they even had their concussion? Because that can factor into some of the symptoms that they may report. So one of the things that I like a lot, and I think is probably the most helpful thing in my practice and when I see patients, is using what's called a symptom score checklist. And so this particular one that I have listed up here has 22 different symptoms. And I'll have the athlete fill this out even before I talk to them so they can give me an idea where their symptoms may be. I don't like to ask just yes or no, or do you have a headache, are you dizzy? Because I know the athlete's answer to me is most of the time going to be no, because they want to get back out in the field and they want to play. And they know if they answer yes to that question, the likelihood of us saying that they're going to be able to get back to play is not very great. And so I have them fill this out and just, again, they do this before I even talk to them in the office. My assistant will give them the sheet and they have to fill it out. So most of the time when the athletes see this, they don't even know what we're really specifically questioning them about. And then I'll use this as kind of a way to assess how they're doing, and I can follow an athlete over time with how they're improving or sometimes with symptoms worsening. And so this tends to be a very helpful thing for me in the office. And this is without necessarily having all the fancy other testing that people can use from a concussion, because not everybody has all the baseline testing and all those types of things that we talked about. Athletes don't have the resources that we have that the professional teams do at every level. And so again, we want to have some things that are available that can be used universally. And so this I find to be a very helpful thing. The balanced error scoring system that was mentioned before, the BEST. So this was developed at the University of North Carolina by an athletic trainer there, Kevin Guskowitz, who's excellent with concussions and concussion research. And there's a couple different tests. In the office, we tend to do what's called a modified version of this, but this is also a test that you have to have a baseline assessment on someone for. If you don't know how someone's ability to balance is on the test ahead of time and they score really poorly on a particular part of this test, that athlete you may think actually has a problem and they don't. Like if I had to do this test I've had numerous ankle sprains on my left side, and I have to do this test where I'm balancing on my left leg. I'm not going to do very well with this, okay? It's also, helpful if we're going to do this test. If I'm going to test an athlete on the sidelines and it's a football player, I want to see what they did how they did this test in their cleats ahead of time rather than in their tennis shoes or barefoot in the office, because I'm going to most likely be testing them in their cleats afterwards. And it's totally different watching someone balance in a pair of cleats than it is barefoot or in an athletic shoe. So again, we want to try and mimic that person's situation if we're going to be looking at them on the sidelines and marrying this. And so what gets done with this is there's 3 parts to this. This gets to be the more challenging part. And most of the time when we're talking about office assessments, we do a modified version, which is the top portion here. So the athlete will spend 20 seconds on each of these tests. All the test parameters are done with the person's eyes closed. And so the first one, their hands are on their hips, their feet are together. We have them close their eyes, and what we're looking for is we're counting errors that person may have with maintaining their balance. Do they have to open their eyes? Do they move? Do they take their hands off their hips? Do they have to do something to maintain their balance rather than being able to stand there steady? Then what we do is we'll put them on their non-dominant foot. So I always ask the athlete, what leg would you kick a ball with? And so that leg they're going to bring up, and they're going to bring it into that little flex position there. And then again, we close their eyes. And if you can imagine, many of you might have a hard time doing that just at a normal level to begin with. So certainly after a concussion, it's a lot more difficult because balance oftentimes is a problem afterwards. And then we have them do the foot that they kick with will be in front of the other one, so it'll be heel to toe. And then again, we do another 20-second assessment. And again, we look at what their score is based on the number of errors that they have in that 20-second period of time. And then we'll look at them afterwards. There are some problems with the test. Obviously, if you practice this test enough, you can get good at it. You can improve your balance, and so there is an improvement or practice effect that we'll see with this. It does get affected by the environment that someone's testing in. I will never do this test on an NFL athlete on the sidelines. We've got a zillion cameras on us. I'm going to do this in the locker room, okay? Because they don't need to be seeing how well they're doing on this balance assessment. And that's not fair to the athlete of trying to balance in front of 70, 80,000 people and going through that assessment. So this is better done in a locker room setting, or again where it's more quiet, that they can really focus on the balancing part of it. So I like this slide. I put this up here. I've used this in concussion talks for years because when we talk about the things that we ask athletes about, it's always helpful to have a little background why we ask them these particular questions. And so this was a study that was done by a colleague of mine in Milwaukee. They looked at high school athletes on their pre-participation exam, their physical exam that they have to do before sports. And they had them do a test where they had to count backwards from 100 by 7s, by 100 by 3s, and then they had them go backwards on the months of the year in reverse. And they had to get 7 of them in a row correctly or 11 with 1 mistake. And so when we're in medical school, we're taught to actually, one of the neurologic tests is to count backwards by 7, count backwards by 3s, and how they do. So people look to see whether or not that was helpful or not. So these are athletes that don't have a concussion, mind you, okay? These are high school students. Only half of them can count backwards by 7 correct, or 11 with 1 mistake. 80% could get through 3s backwards, and at least 90% got through months of the year in reverse. So that's why actually that's one of the test parameters that we use are doing the months of the year in reverse and not these, because at a baseline, people don't do very well. And so, if only half can do it right, sometimes that may be a testament of what our education system is like, especially since they're in high school. I have athletes all the time tell me, God, I can't do the months of the year in reverse forward, or months of the year forward, much less trying to do them in reverse. I'm like, really? You're in 11th grade now and you can't do the months of the year? Again, that's why we use that particular assessment. So the question is who needs a CAT scan? I actually had to do a review recently of a poster that was presented at a pediatric research meeting looking at athletes and non-athletes, basically any pediatric patient that came in with a diagnosed concussion, and how many of them had CAT scans when they got into the emergency room. And I found it alarming, the number that actually had CAT scans. In fact, actually 60% of patients that went into the ER had a CAT scan when they came in with a diagnosis of a concussion. That's not great. And the reason why that is, that's way too high, okay? Less than 1 in 1,000 patients that have a concussion, if we get a CAT scan on them, will have any sort of finding on their CAT scan. And actually, even less than that will have anything that needs any sort of intervention on. And so that's a lot of kids that are getting a lot of radiation to their head that don't need it, okay? CAT scans don't diagnose concussions, okay? Concussions are diagnosed by us asking you questions about how you do, doing assessments on you, not by doing a scan. And the worst thing that I ever hear coming out of an ER is your CAT scan was normal, you didn't have a concussion. Okay? That is completely false information, okay? So again, so who really needs a scan? Well, loss of consciousness has always been suggested as something if they get knocked out, but the question is how long? You know, arbitrarily it says in the medical literature that we should do it if they've had longer than 30 seconds of concussion. But if anybody can tell me what's different from a concussion that someone was out of a loss of consciousness 29 seconds versus 31 seconds, I don't know that there's really a magic thing about that. So again, that's something that's concerning, but it doesn't necessarily mean that they're going to have a finding. If we do their exam, if they have anything that's a focal finding, like say they can't move one arm, that would be something that would be a concern. If they're getting worse over time, they're getting more and more forgetful, they're having a lot more difficulties remembering things, that's a sign, that's a worrisome thing. If they've had a seizure after activity or after a concussion, that would be something. Progressively worsening headache, the headache that just gets worse and worse and worse and worse, not ones that just stay the same. And then we don't have to worry about the intracranial pressure things because that's not stuff for this specific talk here. So CAT scans are the easy test to do because it takes 5 minutes, 10 minutes to do them. They're not going to be able to do MRIs in an ER setting that they take a lot longer to do and require a lot more resources. But CAT scans are typically what gets done. But again, there's way too many kids that I see that get CAT scans that don't need it. A lot of it, when I talk to ER docs about it, it's because of parental pressure. The parent wants their kid's head scanned because they want to be sure. It's not going to tell us anything. So again, this is where the education comes in as far as how helpful that particular test is. And radiation to the head is not a good thing either, okay? So concussion is not good, but certainly radiating that person's brain is not great either. So grading scales, we've already talked about this. They're no longer recommended. Really, if you want to talk about how bad a concussion was, to me, it's how long that course is taken and how much trouble that person's had over the course of their concussion. And you can only determine that when everything's all said and done, okay? So the whole grade 1, grade 2, grade 3 that we hear about and have heard about many times, that's stuff that we don't use. And you know, I have patients ask me, well, did my child have a mild or a severe or moderate concussion? To me, it's you either had a concussion or you didn't, okay? So to me, it doesn't matter as far as where we're grading it because it doesn't mean anything if we were to label it as severe or not. I mean, I have plenty of examples of kids that have, you know, dropped 15 feet off of a deck and landed on their head, and they were in the ICU for a day, and then 2 days later they were normal, and I have, you know, at least 10 girls I can count in my practice right now, one of whom just got hit mildly by a dodgeball in gym class and is now 10 months out from her concussion and still having horrible effects from it. So, you know, again, which one would you grade as being the worst concussion? Obviously the person who's taking 10 months to get better rather than the person who got better in a couple days. So recovery time. So many research studies suggest that the younger the athlete is, the longer the recovery. We know girls also seem to take longer than boys to recover and oftentimes have more symptoms. The girls that I have the biggest trouble with as far as getting them better quickly seem to be between this 9 and 13-year age group. I'm not sure why that particular age group has the biggest difficulty, but they seem to. But the good thing is that most concussions, so 80% of them, are back to normal within 3 weeks following their injury. And I put normal in quotations because, again, we're saying that they're normal because they say they're normal. They may have turned normal on all of their testing, but is the brain really normal at that 3-week point? We don't know that, and it's hard to determine that because we don't have one specific test that can say, yep, you're absolutely totally back to 100% normal. So we talk about brain rest. So this is a newer concept for a lot of people. There's two things that I tell everybody will make their symptoms worse after a concussion. One is physical activity, and that's where Christy was talking about the energy problem in the brain, where the brain can't process, it doesn't have enough glucose there. So when we exercise someone, when we get their heart rate up, they're bringing more blood flow to the brain, which brings more energy to the brain. And the brain already can't tolerate the level that it's at that level already. So when we add that heart rate going up and we make them exercise more, they feel worse. So that's why it's important that we're not having them be physically active early on and making them think, do things, okay? So the more we have someone try and focus on things, whether it's schoolwork, for football players, watching game film as an example, studying the playbook, very difficult for athletes to do that after they've had a concussion. And so early on, those are two very important things that we want to make sure that we're restricting or at least reducing the amount that they're doing with those. So we want to restrict all physical activity. So that may be gym, recess, their sporting activities, working out, other recreational things that people don't think about, skateboarding as an example. And so those restrictions may change, and we may be less likely to restrict some of those things, and again, it would be in a controlled setting if they have more prolonged symptoms. So the athlete that comes in has had symptoms for 2 months, I'm going to treat entirely differently than the athlete that I've seen that's there for 2 days after their concussion. So that athlete, I may let them do a little bit of physical activity, not contact if they're still having symptoms, but I may let them start to do some physical activity because that actually can be helpful for them. So we want to reduce the amount of cognitive stress. Now, I tell all my athletes when I see them, summer is my favorite time of dealing with concussion patients because I don't have to worry about school. School is the most challenging thing for our school-age athletes just because, again, they're making their brain have to work a lot, or hopefully they're making their brain work a lot while they're in school. So reducing their school load, giving them extra time or untimed tests, maybe tutoring. We talk about limiting video games, texting, reading, computer use, TV. Now that doesn't have to necessarily apply that across the board that person has to eliminate those things completely, okay? That's an individualized thing. So some athletes may have a lot of troubles with those and some athletes may not. And so really it's from person to person. So if someone comes in and tells me, yeah, I can play this video game, it doesn't bother me at all, I don't get any symptoms, I play this other video game, it makes me feel awful. Well that's, I'm gonna tell them, don't play that video game that makes you feel awful. And then the other thing to remember is restrictions on driving. So the kids that can drive, is reaction time is definitely an issue for athletes after they have a concussion. It's delayed. And so they're already at the highest risk for car accidents to begin with already, and then we put them behind the wheel. The scariest example I had of that was a kid I saw in my clinic 2 years ago. And when I asked him about his concussion, he told me all the events. He said, yeah, I got a concussion on the football field. Got out of my car. I threw up 2 times in my car. I got to my girlfriend's house. I don't remember how I got to my girlfriend's house. I didn't remember whose house I was at. My girlfriend knew who I was, but I didn't remember who she was. We got back in the car. He's behind the wheel driving his girlfriend around. He doesn't know the events of what happened from when he picked his girlfriend up until he got home. And that was at least a 3-hour time span after that. So that's a problem, okay? And that kid was behind the wheel the whole time. So I would not put a kid that's of driving age behind the wheel that day after they get their concussion for sure. So with brain rest, the other thing I think is important from everybody's standpoint, parents, physicians, is making sure we're involving the school early in the process, letting that school know that that kid has had a concussion. So, if I had all of you in the audience right now and someone had to ask me and put me on the spot saying, can I tell me which kid in the audience has a concussion right now, or parent or what have you, I can't tell you just by looking at you, okay? That's the teacher's problem too. That's your teammate's problem. That's your peer's problem, your coach's problem. You look normal, okay? But things inside the brain aren't working normal, okay? And so that's where a lot of the struggle comes from with concussions, is that people, you're not coming in on crutches, okay? You don't have a big bandage around your head with a little flashing light that says, hey, I'm suffering from a concussion, although maybe we should do that. But, again, if the school's not knowing that you're having difficulties, they can't help you out. And so for me, making the adjustments at school early is important. That may involve some days off of school, and then making sure that we're following up with the school that adjustments are being made for that athlete. And then the biggest problem that I have are the high achieving students, the A students that are in all the honors classes. They don't want to give in to the adjustments. And so it's really making sure that they are giving themselves that period of time to let themselves recover. So the athlete with prolonged symptoms, this is where we have to involve other people, and that could be school administrators, teachers, counselors, psychologists, psychiatrists. There are certainly high rates of depression in any athlete when you've taken them out of their sport for a long time, okay? That's their identity. They're an athlete. Okay? They want to be playing their sport, yet we're telling them they can't. And so they get depressed. Okay? I have example after example of kids that, certainly after a while they get suicidal sometimes, or they have suicidal thoughts because they're not able to do what they want to do. So that's why it's really important that we're keeping on tabs of these kids that are having prolonged symptoms. Because of that loss of identity. And then various other people, so a sports medicine specialist, neurologists, neurosurgeons, someone who has further experience with concussion management and brain injuries. Neuropsychologists can be very helpful. And then sometimes physical therapists. A lot of athletes will have a lot of neck troubles after a concussion. Vestibular therapy, athletes that have a lot of dizziness, that have a lot of troubles with looking side to side. That also can be helpful. So there's lots of things and resources that we can use in order to help someone recover after they've had a concussion. But again, this is being actively engaged with that athlete and knowing what troubles that they're having to help them out. So the baseline test. So I was asked to talk about baselines and what's the most helpful baseline test. Well, there's various forms of baseline tests, and unfortunately when we talk about baseline tests, it can mean various things. So for most people, what the baseline test is the computerized test, okay? Whether that be Impact or CogSport or Axon Sports now, Concussion Vital Signs, there's several that are out there. That's a computerized test that take anywhere between 10 minutes and 20 minutes to do. There's balance assessments, like the BEST assessment that we talked about earlier. The SCAT-2, just having someone go through that assessment that we do on the sidelines and seeing how they do before they have their concussion and using that to compare later. Sometimes just simple reaction time tests. There was actually a presentation at a sports medicine meeting I was at a couple months ago that suggested that reaction time was actually the best thing to follow in someone afterwards. And there's various ways that we can do that, either computerized or non-computerized. So all of them have issues, okay? None of these tests are perfect tests. So I think part of the problem is that these tests have taken on a huge life form of their own, and it's get your baseline, get your baseline, get your baseline. But the important parts about the test is who's going to do it, who's going to pay for it. Okay, these tests aren't free. Okay, who's going to look at them afterwards, and is that person qualified to look at them afterwards? It's not a coach that should be looking at it. It's not the parent who should be looking at it. Okay, and those tests are not red light, green light tests. Okay, so it's not that this person does well and they're back to their baseline, and that is the one determining factor. Okay, an example I'll give you with the Rams. So Mark Bulger, who was a quarterback with us for many years, he had a concussion. He had not returned to his baseline as his first assessment that he had. Next following week, he did return to his baseline, but he was still having symptoms. And so we actually held him out an additional week until his symptoms got back to normal. So, in the papers they talk about, yeah, he failed his baseline test, which you can't fail your baseline test because that's how you do normally, but he hadn't returned to his baseline test. And then the following week he had, and the paper reported that, and then we get flack for holding him out an additional week. But that was the right thing to do because he wasn't back to normal. He had gotten back to his baseline on his test, but he was still feeling the effects of his concussion, and that's a totally different thing, okay? So we don't want to have someone go back to play while they're still having symptoms, even if these tests may be back to their baseline level. And there's no one test that can do it all, okay? So it's not like this test is the end-all, be-all, and the gold standard, and this is the only thing that we use to assess them. You have to use multiple tools to evaluate that person in order to say, are they back to normal, okay? So there's no red light, green light test. So the issues with the baseline test: who does it? Where is the info kept? How quickly accessible is it to that person? Where do you use it? Is it in the sideline in the office, the cost, and then validity? And so, a lot of tests are promoting themselves as being the gold standard of assessing concussions, but there is no such thing right now, okay? So again, we have to kind of take all these tests with a grain of salt. It's great if you have access to do some stuff and you have some sort of baseline assessment, but again, it's also making sure that the people who are assessing that person afterwards have access to that information and know what to do with it and what it means, okay? Just because someone has a baseline test that's done at their school and you take it to the pediatrician, if the pediatrician isn't comfortable with those tests or haven't been trained in how to interpret those, that test doesn't mean much, okay? So that's where everybody involved has to understand what these tests mean. So again, it's one tool in our toolbox that we use to assess concussions. It's not the only thing. It's, again, not the only determining factor for return to play. There's several that are out there, as I mentioned. And again, a lot of teams are using these at various levels. Obviously, those that have more financial resources, it's going to be a lot easier to implement these tests than others that don't. It's a lot easier to do it on a team of 55 football players than it is for a high school that has 300, 400 kids or even more that you're going to baseline on. So again, we're talking about different things here. So what are benefits of the testing? So it gives us some data of how the brain is functioning, because people like numbers. It may pick up the athlete for us that maybe not be as forthcoming with how their symptoms are doing. The athletes that come into my office and fill out their symptom score checklist and draw a zero or circle the zero on the top and draw a line straight down, those are the athletes I worry about. It's been used for many years now, many of the tests. It's easy to administer because you just need really a computer to do it. But if kids are having prolonged symptoms, they're not as helpful as tests. That's where we're going to involve a neuropsychologist to do more comprehensive testing to see if we need to make some adjustments for that particular athlete. So what are other issues? How often do we test them? Is it helpful to test that person while they're still having symptoms? I'm not a big proponent of testing an athlete if they're having symptoms because it's a test that's making their brain work. And that's what we're trying to modify and not make them do as hard. And it's not going to make me get that athlete back any sooner if I test them while they're still having symptoms. Okay? I'm not going to let that person go back to play. Again, having a baseline versus not having a baseline. Things to remember about these tests: the computerized tests aren't validated below the age of 12. There's a cost. Again, who's going to interpret it, and is that the best resource or the best use of the school's dollars? I mean, I'd much rather see a lot of education put into concussions like what we're doing today so that everybody's on the same page. And unfortunately, a lot of the tests that have shown how good these tests are done by the companies that develop them. So we always, again, have to take that with a grain of salt. So I like this quote here because I think it just brings home, we talk about concussions being a hot topic now, and this is all brand new. So this is a quote from the 17th annual meeting of the American Football Coaches Association. I actually borrowed this slide from Kevin Gutzkowitz at a talk that he gave, so I have to give him credit for it. But during the past 7 years, the practice has been too prevalent of allowing players to continue playing after a concussion. Again this year, this is true. Sports demanding personal contact should be eliminated after an individual suffered a concussion. Anybody have any idea what year this was at? Even a gander? 1937, okay? So we talk about this big issue as far as concussions right now, but People have been talking about this for a long time, okay? Sometimes it goes by the wayside and doesn't get as much, but people have talked about not necessarily letting athletes return to play afterwards for quite some time, okay? So again, this is a hot topic now, but it's been a hot topic technically for a long time. So returning to play has already been talked about. We don't allow an athlete to return to a game practice if they've had a suspected or a diagnosed concussion on the day of their injury. We won't allow that athlete to return to play, practice, or exertion until they're asymptomatic at rest. And then there is not a defined set time frame. So as Christy mentioned earlier, it's not a set time I'm going to give someone. I tell everybody up front, I deal with concussions all the time. I cannot predict when that person's going to be back to their normal self. Okay, everybody wants to know that, but there's no way, there's no predictor that I have. I can't tell someone to their face, you're going to be fine in a week, you're going to be fine in 3 weeks, you're going to be fine in 3 months. I don't know that ahead of time, okay? That's the hard part. That's what makes my job with this challenging. I like that part of it because it's an interesting part of it, but again, there's no set time frame I can give that particular person. And then as already has been discussed, we do a stepwise return to play. So again, what do? No activity until they're asymptomatic. We start with some light aerobic activity. We'll do some sport-specific training. We'll do some non-contact training drills, and then full contact training after they've been cleared to do so, and then back to a game. So medications, people ask about using medicines afterwards. So anti-inflammatories, Tylenol, all that stuff, none of them have ever been tested as far as the use of managing a sports concussion. We use them a lot, they're recommended a lot. I don't find that Tylenol and ibuprofen tend to be very helpful for headaches after a concussion. Very few patients that I see actually does it really make a big difference in their headache. And that's because their headaches are different. It's not an inflammatory problem, so we're not talking about inflammation that we're trying to settle down with ibuprofen or Aleve or things like that. So there may be some medications that we use for athletes that have more prolonged symptoms, and again, these are where your concussion specialists, your neurologists and what have you, sports medicine doctors are going to help you with this, and there may be things that we use to help them sleep, to help them focus, the non-conventional headache medications, antidepressant medications, but that athlete needs to be off of those medications that were used to help them out and be out of they don't have symptoms before we let them go back to play. We don't let them go back to play while they're still taking medicines to help control their symptoms. Retirement from sports. This is tricky. There's no magic number, okay? So we need to consider that if someone's had very prolonged symptoms, an athlete that had taken 1.5 years to get better from their concussion, even though it may be their first, that discussion I'm going to have with that athlete is, do we want to potentially go through this all over again? And so again, it's something that we need to think about. Athletes with multiple concussions, but again, there's no magic number. So, different people have different thresholds as far as how many is too many. And that's the hard part. We don't know how many is too many. Is it 1? Is it 5? Is it 15? Is it 50? We don't know that. But again, this is where it's important to get someone involved who deals with sport concussions on a regular basis as far as to help to make those decisions. Education, this is role models, and this is a good segue for the gentleman that we have coming up next. And so this is from November 2009. We had 2 Super Bowl quarterbacks that reported that they couldn't play in their upcoming games due to persistent headaches and not feeling that they had recovered from their most recent concussion. So that's Kurt Warner up on the top, who's well known to us in St. Louis, and then Ben Roethlisberger below. I put him smaller just because of the off-the-field issues he was having at the time. And Kurt's a much bigger person in St. Louis than Ben is. So that's why their pictures are a little bit different, skewed size-wise. But interestingly enough, they were called out, both of them, by wide receivers on their team for being soft and not going back to play that next game. And they should have been a leader as a quarterback going back to play. But they didn't go back to play the next game. So if these 2 guys can say that and be out and stay out, how important is it for that high school athlete for their next game? Okay. So again, this is where we need this to come from, is from guys like this. And then Peyton, I used to like Peyton until he came out with this quote in USA Today. So they have these new brain tests that we have to take. Before the season, you have to look at 20 pictures and turn the paper over and then try to draw those 20 pictures. And they do it with words too, 20 words. You flip it over and try to write those 20 words. Then after a concussion, you take the same test, and if you do worse than you did on the first test, you can't play. So I just try to do badly on the first test. Okay, that's not what we need to hear, okay? That is bad, okay? So, like I said, I used to like Peyton a lot. Peyton still is a great guy, but that's not the stuff that needs to get published in papers that guys are intentionally dogging their baseline tests, okay? I mean, come on. So, other things that are being done as far as education, this in the Madden football game this year, they try and make the game as realistic as possible. And so the game this year will keep an athlete from play if they suffer a concussion. It eliminates hits to the defensive player in head-to-head shots. So, in the game you used to be able to kind of ram players into each other. I mean, I remember playing NHL 93 years ago where, if you guys remember that game, those have been around and long enough to remember that game, you can actually take your hockey player and nail him into the other player, and the player would fall on the ground and they have a seizure and blood would come out of their head. head, and that was the cool part of the game. But again, they don't do that anymore. And then actually the announcers will do education during the injury, talking about concussions. So again, I think it's great to see stuff like this that's getting put into these things, and hopefully more stuff like this will happen as far as other ways to get people educated about concussions. And I found it interesting that the press shot that they actually have on Madden to talk about this happened to be a Rams player. That's Grant Winstrom. That was when they were playing New England in the Super Bowl. And so I just found it coincidental that that happened to be there. I didn't specifically concuss a Rams player in the game and then put him on the picture there. So let's talk about these again. So what would you do for this person that we talked about, that 17-year-old high school football player? D, that's right. So if he wants to play in 2 days, even if he was fine, which he's not, he still wouldn't get through our activity progression soon enough, okay? That usually is a 4 to 5 day process. So if he really wanted to play in that game in 2 days, I can tell him right up front that's not going to happen, okay? So that's that. And then once an athlete's testing has returned to their baseline, they may return to play. True or false? False, correct. So that's one component of what we use as far as testing that person, and that's why I use Bulger as an example. So this is the clinical report that we put together. This came out in September of 2010, so this is my labor of love for a whole year, and my wife will tell you that, because this is all my time consumed of. I wrote this with Kevin Walter, who's a colleague of mine in Wisconsin, and we basically tried to have some information that wasn't out there, at least not readily accessible, that pediatricians had at their disposal right away, that just talks about concussions. So again, just part of our effort to try and make people more educated about concussions and why they're important. We will be coming out with some new information as far as how do we return athletes to school after concussions. That'll hopefully be out by this winter. And so stuff that we just continue to work on. And again, I think the education part, things like this are really important. So I'm not going to steal the thunder from any more of the players here, because I know they'll give us some valuable insight as far as their playing days and issues that they had. So that's all I have. So thank you.
Great. Thank you very much, Doctor. Well, I think with our 3 medical speakers today, we have a pretty good idea that the level of consciousness has come up quite a ways, but it's been a long-term problem. I had the opportunity about 3 months ago to interview John Madden, obviously a Hall of Fame coach and broadcaster, right here in Pleasanton. And he is now on a safety committee, along with Ronnie Lott, of all people, on a safety committee. But they are really, really ensconced with the idea of public awareness and doing everything they can to make, in their sport, particularly the NFL, as safe as possible. But John told me 2 things, 2 little stories that really brings it into focus how far we've come. He was obviously a head coach, and he used to say when players would get injured, they'd come to the sideline and figure out what the injury was, and they used to actually say, "Oh, he's just hitting the head. Thank goodness it wasn't his knee or his ankle." That's the kind of view they had. Another thing he said is, as coaches, they literally used to tell players, if the doc comes out and tells you, how many fingers do you see, always say 3, because they always hold up 3. And that gives you an idea of exactly what the prevailing attitude was back then. Obviously, it's changed, and it continues to change, and I think we all feel for the better. But there is still a lot of improvement that can be made in a lot of areas. I thought it would be really interesting to try and get the up-close and personal views of some former NFL players, and I want to introduce you to the folks that we have today. I also want to just take a moment to thank them. They're doing this on their own time and their own level of conscientiousness and involvement with youth sports activities in their post-NFL lives is just another reason as to why they're here today. So, gentlemen, when I call your name, just come on up to the panel, and we'll be joined by the doctors who have also spoken. Want to mention to all of you that in your packet, there's a little, I think, 3x5 card, and if you have a particular question, because you don't have a microphone, it'll be easier if I just read your question on a microphone. If you have a question for a particular player, there are volunteers that'll come along, just raise your hand, and they'll grab your card and make sure that your question is heard. First up, He still lives locally. He played 8 years in the NFL as a defensive end and a defensive tackle, played with the Seahawks, the 49ers, and the Raiders. Please welcome Chris Cooper, if you will. Get your first choice of seat there, Chris. Wherever you want. All right, a 7-year veteran of the NFL, played with the Raiders and I believe the Jacksonville Jaguars, and one of the nicest guys you'll meet. Met him at 24 Hour Fitness. He's dedicated his life to physical fitness post-NFL career and is now studying acupuncture. So look for him at a facility in the near future. Please welcome Josh Taves. Our next guest played 12 years in the NFL, mostly for the San Diego Chargers and the Oakland Raiders. And John, if I'm not mistaken, you're now coaching, helping to coach at Valley Christian High School here in the Valley. And he's very concerned about this for his young players as well. John Perella, ladies and gentlemen. So we've got 3 defensive guys and our one off. I don't know what that says about this group. 3 defensive guys, 1 offensive guy. They won't be picking on him, I guarantee you that. Raymond Chester had just an unbelievable career in the NFL with the Raiders and Baltimore Colts. Raymond Chester. We want to invite our doctors, and I have another doctor I'd like to invite to speak on the panel here, Dr. Curtis Auguste, who is a neurosurgeon at Children's Hospital. If you want to come on up, and our previous doctors. Thank you. And, I thought maybe a good way, and as I said, I really want to make this, interpersonal, and I want to get the audience involved. But I thought maybe a good way to start would just be to ask the players individually to talk about maybe a personal experience they had, whether they were officially diagnosed with a concussion or any experience or story that might have come to mind as we're watching the program today. Raymond, maybe you want to address, how do you think, playing in the era that you did, how have things changed in your own personal experience, seeing how this issue is regarded nowadays as compared to back then, and your own particular experiences? Did you ever have a concussion yourself?
And have I had concussions? Sadly to say, I've had many. And I can remember one that I'll tell you about. I was playing in a game for the Raiders, and it was a big game. I remember we were playing the Houston Oilers, and Ken Stabler was a then quarterback for the Houston Oilers. And there was a play, ran the play, I ran downfield and was making a block or something, and somehow I got kicked in the head, and I was woozy. I got up from the play. I went back to the huddle. I got in my designated spot in the huddle, sit there, looked at the quarterback, had my hands on my knees. The quarterback called the play, broke the huddle, and when he broke the huddle, I started wandering around. I didn't know where I was, wandering around because but all this other stuff happened kind of automatically. I guess, doctors, you can maybe explain this. Did everything that was normal, ran back to the huddle, got in the huddle, got in my position, broke the huddle, started to go, and then I couldn't remember anything. So yeah, concussions happen, and they happen in a lot of different.
All right, this question is directed to Dr. Boyd. Any indications as to why recent literature suggests that women basketball players are more likely to sustain MTBD over their male counterparts?
The MTB, meaning mild traumatic brain injury, otherwise known as concussion, it goes back to the information on the slide, which is that, We don't know if there's an increased incidence of, when we match boys and girls in the same sport, girls are more likely to be diagnosed with concussion. That we know for sure. Again, soccer is much more common than basketball, but we don't know if it's because girls are more likely to report, just from a cultural phenomenon, or if it's an issue where there's a neck strength issue and the girls are more susceptible to having the concussion, or there's a function of a female brain versus a male brain. That we don't know very well, but we do know that they are more likely to report them and be diagnosed.
Okay, thank you. Question here. Bear with me on the handwriting. How do we ensure that teen athletes are not intentionally doing poorly on their baseline tests?
That's a tough one, because some of the tests will have built-in parameters that may suggest that they perform poorly. But I can give you example after example of baseline tests that I have that you look at that person, if I showed it to someone who does these tests and say, would you call this a baseline test or a post-injury test? And they 10 times out of 10 tell me it was a post-injury test, but that's at that athlete's baseline. So some people just have bad baselines, meaning not everybody performs at 100% level on each of those tests. In fact, no one can perform 100% on every part of those tests. So it gets difficult. It's hard to specifically say that someone's dogged the test, but it's something that we get concerned about. And again, that's why we can't just rely on that particular parameter alone as saying that someone's back to normal. I wanted to just make one comment that I think kind of mirrors what all the players said is, from us, from the medical side of things, and kind of the example I gave in the or during my talk is that I can't pick out which one of the audience had it. A lot of times what we're relying on is athletes to report to us their symptoms. It's easy when the player gets knocked out on the field. Okay, that's a no-brainer. The no-brainers that we're talking about. Okay, the hard part is that guy that gets dinged or gets hit hard, and they go back out there and they look like they're doing fine. Okay, so I mean, sometimes it's I'll get a coach that tells me that so-and-so's not doing right, or I get a teammate that says you got to go check this guy out. That's a lot of times where we get that, but that's where us having eyes on the field, and I think a lot of things that the NFL has done in the last year or two with other things that are available to us as far as resources on the side of it is helpful. But you know what? That doesn't happen at the high school level. Okay, so it's just vigilance and really making sure that people and stressing the importance of reporting that they're having troubles.
So something happened to me recently that really brought this home for me, in that I used to play competitive soccer in high school and in college, and then I got into medical school and I did my training. So all that stuff went out for a while. Only recently did I actually start playing soccer again, because I wanted to stay in shape, and it was the one sport I could play where I didn't have to use my hands. So I was on the field and I took a header directly to the head, blocking a corner kick. And here I am, a pediatric neurosurgeon, and I counsel hundreds of kids a year on concussions. And for a couple of seconds, I was completely disoriented. And I kind of went into automatic mode. I was still in the right position on the field, and the play was still running. And I couldn't process what had just occurred, and then the play started again. Same corner kick, because I had headed it successfully out, came again, hit me in the head, second time. And so again, I was just for a second shocked. And now I know, on any other circumstance, I would have told myself, get off the field. You probably just got your bell rung. But for one split second, I was both the caregiver and the athlete. And so I think the solution is going to have to be that these two groups, the caregivers and the athletes, we have to meet each other in the middle. We have to talk to each other and understand. On the caregiver side, the athlete wants to stay on the field. And on the athlete side, of course, these people want to help me. I think it's going to have to be some buy-in from both ends to say, look, we have to come to a middle ground here.
Yeah, related to that, I think something John Perella said that struck me is even when he won his own starting job and talking about players, they don't want to come out of there. And we can all sit here on a panel and get together as a group on a Saturday afternoon, but there's a distinct difference between high school athletes and professionals. And I was just curious, do you ever see in any of the former pro players, or even doctors could answer this, do you ever see a time where this really sets in, where there will be a culture where guys, it's hard for me to envision guys really stepping up and telling the truth when they have millions of dollars at stake with regard to a job, and being able to just fudge that a little bit. Anybody who wants to address that? John? Or
I don't ever see that happen. I really don't. Just mean, there's, you know, just think back when I was in high school, you get hit in the head, the coach would say, now you're a football player. Well, you know, concussions have gone, you know, into other sports. Obviously, they're seeing dangerous effects of what can happen. But the pro game has changed even so much now into it's almost turned into an entertainment business where the money's really gotten exorbitant. I just can't imagine these guys being completely honest and a chance to lose out on money, because if the best player in the NFL is the guy who plays every game and every play, and any of these guys will tell you that's the best players. I mean, I think I went 10 straight years without missing a practice or a game, and those things. That's what the best players do. I mean, as a high school coach, obviously you have to think different with the young kids, and we can't have contact every single day because you have to be very protective of these boys. But in the pros, those, the new CBA, the new contracts are things where they can't hit every day, and those type of things will help. But I think you're going to see players continue to hide and mask injuries because of the financial well-being at the end.
Right. Yeah.
I was going to add something there. I don't think we'll ever be able to completely get everyone to admit when they're not up to playing, and I know that we as caregivers won't always be able to pick out who those players are, but when you have players like, there's a young cornerback at the Vikings who I think he only played 2 or 3 years, and he announced he was going to retire, and the suspicion is that he's retiring because he may have suffered a few concussions, and what's been going on in the NFL, you've lost, like when you lose a player like Junior Seau, after a long illustrious career, it hits home. I think more and more players may step up and voice an opinion, and the kids and the athletes, the younger athletes, will say, well, now if a player of that magnitude can step up and say it's okay that I have a head injury and I don't want to play, it will be more and more acceptable, so the culture may change, and we might be able to save maybe a few more players serious injuries, although I don't know if we'll ever be able to completely get to everybody.
All right, we had a question here. Actually, it's a couple of questions for Dr. Wyatt. Does Kaiser have a plan to start doing baseline tests? And what tests will you be doing? And then finally, how soon will the student be seen after a concussion, I guess? Hard to read the writing. But.
Great questions. We've put together this program initially and started on development of our protocols or procedures to make sure that we had the best concussion guidelines and care paths initially. That was our first focus. We're now moving into the implementation phase where we are discussing baseline testing, making sure that all of our providers are able to properly care for concussions. So that's our second phase that we're moving into now. It's not there yet. We're not offering baseline testing for all Kaiser patients, but we're getting there. And we're partnering with, many of you know, the Wells Fargo program and some of their programs are out there to be able to provide more this kind of baseline testing for everybody, but we're not there yet.
All right.
Second question was?
Second question was,
how
yeah,
soon seen?
yes.
We have, the majority of our patients right now do come into our emergency departments and our minor injury clinics, and those are people that we're focusing on to get the basic testing and the basic care path education for them first. Secondarily is our pediatricians and our PM&R doctors, physical medicine and rehabilitation doctors. So we're doing that training. That's an ongoing program now, and we hope to get that all completed in the next few months. Our goal is to have standardized care for every single member of our program. In other words, it doesn't matter if you go to Redwood City or Walnut Creek or wherever you show up, that the cities have the same evaluation, the same management, the same recommendations. Everything will be standardized, so you'll get outstanding quality care no matter where you show up. And that's going to take some work, and it's going to take some effort on all our parts.
Thank you, Dr. Wyatt. Thank you, John. Another question here for Dr. Auguste. Is there a way to determine if anxiety and depression are linked to brain injury? And if it is related to brain injury, what would be the best treatment in your opinion?
That's a very loaded question there. I think we're learning still. As more and more stories come out about players who had long careers and multiple head injuries and the potential outcome of that, repeated hits to the head, I think we're learning more and more. I don't think we have the answer to that just yet. And you're asking a surgeon, how would we treat that? Well, I don't believe there's any surgery for that at this point. There are technologies on the horizon where we can actually modulate brain activity with tiny devices, but they're very, very experimental at this point, and it won't be for a very long time that we recommend that. Medications will still be, the first line of therapy.
That could be, some of the folks up on our panel today talked about loss of identity, with when even a high school kid gets hit and can't play his sport. There was talk too, Junior, loved the game so much and it was such a part of his life that it all may have been incorporated. Obviously, anything we say is just speculation at this point, but it does become a part of their life and identity, wouldn't you say? You work with the players too, right? Yeah.
I just have a comment. The pediatrician in me just jumps out when you say that. It is affects the kid's identity, but it really is the parents who have to be the advocate. I can't tell you that it almost affects the parents' identity sometimes as much as the kids. I mean, the parents are upset because they paid the money to go to the tournament and their kid can't go to the tournament and they need to get back on the field. How am I going to tell the coach? And so it's really important that parents have to act as the advocate for their kid and don't expect the 14-year-old kid to be able to say, I can't play and I'm going to be okay. They may go through this process, but you as the parent need to step in and say, no, it's okay. We're missing the tournament. We're not doing it. I'm going to talk to your coach because the kids can't do it themselves. They need help.
All right. Well, I got to get you. You're a patient all day. Get your last. Did you have a question? Or?
Yeah. You talked about the SB whatever number of the bill, but it doesn't seem to cover education as far as
That's correct. The only education is the parent form that they decide what education was.
So all of this is moot if the coach doesn't know about it.
Right. There's a big Cindy Chang at Cal. She's actually the chief medical officer for the Olympic team that's coming up, and Eric Freitag, a neuropsychologist, are forming they're working with a group from back in Boston. They're copying what Boston is doing as far as the California Coalition for Education and Concussion, and it's coming out. And they're starting with the Oakland Unified School District this year as a pilot program to fill that void because there's no rule, there's no law about education, but it's coming down. People are working on it. Yes, soon, hopefully.
Thank you. All right. Well, Dr. Halstead, Dr. Boyd, Dr. Wyatt, and Dr. Auguste, thank you very much for all your words of wisdom today. We appreciate it. And to our panel of pro football players, John Perella, who had to leave, thank you for your time. Josh Taves, Raymond Chester, and Chris Cooper, thanks for being here.